This presentation will cover the recent improvements in the sonographic detection of ovarian cancer. I want to give a tribute to Dr. Barry Goldberg, who has helped guide some of this research and certainly has helped me in my quest to develop new techniques in ultrasound. This is a picture of my sabbatical at Dr. Goldberg's. We imbibed 8-drink ultrasound, and I again am indebted to him and his staff for giving me some of the ideas that 20 years later I am going to present during this talk. Basically, this talk is going to cover concepts concerning improved sonographic detection of ovarian cancer using morphology, using color Doppler sonography, using 3D, and also the new development of using contrast ultrasound in finding differences between benign and malignant ovarian masses. Microbubbles can be used off-label for general purposes in this country, but is not FDA approved at this point in time. We hope this will be changed in the very near future and have microbubble technology available for general applications. I am an unpaid consultant to Philips, and I am the recipient of an NIH grant concerning contrasted sonography. Basically, I'd like to cover some of the principles concerning color Doppler and amplitude or power color Doppler, and discuss the role of these technologies in depiction of tumor neoangiogenesis, and of course apply this to differentiating benign from malignant ovarian lesions. As we know, color Doppler allows us to understand the physiology concerning blood flow to the ovary and other structures, and it is hoped that it improves the differential diagnosis of ovarian masses over that based on morphology. Morphology meaning assessment of tumor wall, tumor papillary excrescence. Those are morphologic features. Now, in any new technology, it seems that there's a early part where it's great, 95% accurate, etc. And then there's an era of what I call inappropriate enthusiasm, where it's used for everything, and it's then an area of time of skepticism where we can understand it has some limitations, and then finally in reality it finds what its particular niche is in the clinical world. And I would say color Doppler has passed through these stages and is now a very useful technique in differentiating benign from malignant masses, and as well as making the diagnosis of torsion, which I will not cover in this presentation. Now, color Doppler depends highly on the angle at which we examine the vessel, and I would say not only does the amplitude of flow in the vessel count in its depiction, but the angle at which it's interrogated has a very important role in its depiction. And rather than quantifying the relative impedance values, the RI, which is resistive index, which is systolic minus diastolic over systolic, or the pulsatility index, which is systolic minus diastolic over the mean, we really can differentiate high from low resistance and also detect when there's reverse flow, which is a very high impedance to forward flow. Now, these flows depend on several factors intrinsic to the tissue that we're looking at. It depends on the downstream resistance, the vascular tone. Is the vessel constricted or is it dilated? And finally, in interstitial pressure has a very important role as to what we see with color Doppler. A lot of tumors have very high interstitial pressure, and that affects the flow to the center of the lesion. And it also parenthetically affects whether or not chemotherapy can get into the interstitial portion of the tumor. Now, it was theorized that if we look at the various vessels, the one on the bottom is a tumor vessel that lacks a muscular media, that there is increased diastolic flow in these tumor vessels as compared to the vessel on the top, which has a muscular media which constricts a blood flow, and the differences in the waveform are significant. Now, the vessel in the middle is a vasodilated normal vessel, which can have a very similar appearance to either normal or neoplastic vessels. Another way of analyzing the color Doppler signal is by looking at the area under the curve, which is a reflection of the red blood cells that are coming into the field of view. And with using power Doppler, we can get even smaller vessels and their flow. And this is to differentiate the frequency-based color Doppler, which is very good but not as sensitive as color Doppler, as amplitude color Doppler. Now, as Fleming Frostberg showed many years ago, that amplitude or power Doppler has advantages and disadvantages. It improves our sensitivity, but it is susceptible to tissue motion artifacts, and there is no aliasing with amplitude Doppler, but there's no direction or velocity information. And there's limited temporal resolution, and this is going to play into when we talk about tumors and depiction of small capillaries, that the Doppler technique is in fact limited relative to contrast where you're looking at small capillary flow. Now here we have a side-by-side comparison of frequency-based imaging and power Doppler imaging. And as you can see in this image, we have a multiloculated tumor and we have a few color Doppler signals, but with power Doppler we can depict the vessels in the wall of this hemorrhagic ovarian cyst. This is another patient who's has a solid mass, and we can see that there are no central vessels, indicating that it was most likely a benign lesion versus a tumor which would have central flow. And we can see this on the power Doppler. We can see vessels only along the periphery. Now, basically, with that lesion, we depicted the larger vessels we could see on the vessel staining compared to the H&E staining. We could see pretty much what we were looking at with the power Doppler signal. This is a 3D representation of a normal ovary, and we can see that there are branching points and very orderly branching of the small arterioles inside the ovary, as shown histologically on the right, that have a muscular media. Now compare that to what Dr. Schonenfeld showed many years ago in a tumor. There's arteriovenous shunts, there's a tangle of vessels, as we can see here, and these vessels lack a muscular media, as shown histologically here. So one would think that their Doppler signals, and as we can see with contrast, that their entire flow pattern is different. Now, neoangiogenesis is a very important process in normal tissues, in corpora lutea, in placenta, in wound healing, for example, but these are regulated. After they're done, they're ended. Tumor blood flow is not regulated and continues to progress.